Today's webinar is titled The Importance of Using Prevention Science in Marijuana Policy. It is my pleasure to now introduce our presenter. Scott Gagne is a certified prevention specialist, the director of AdCare Educational Institute of Maine Incorporated, and the director of the New England Prevention Technology Transfer Center. Scott chairs the National PTPC Network Marijuana Risk Work Group. Appointed by the Maine Speaker of the House, Scott serves as the public health representative on Maine's Marijuana Advisory Commission. In addition, he chairs the Maine affiliate of Smart Approaches to Marijuana and has also served as co-chair of the Prevention Task Force for Maine's Opiate Collaborative. Scott recently served on the SAMHSA, Center for Substance Abuse Prevention National Advisory Council. Scott trains and prevents and presents in New England and nationally on marijuana science and policy, as well as on prevention workforce development. Scott's work has been recognized with awards from multiple organizations, including the Maine's Alliance to Prevent Substance Abuse and Maine's public health organizations. In 2017, Scott was the recipient of the Patrick J. Kennedy Outstanding Advocate Award from Smart Approaches to Marijuana. I will now turn the time over to Scott Gagne.
All right, thank you. I'm glad to be with you virtually today, and I hope everyone is doing well, holding up amidst our national public health crisis here. Was actually supposed to be there in person today, but I'm glad to be able to join you virtually, and hope in the not too distant future, I'll be able to come out there to work with you all on this topic. But yeah, I'm very glad to be with you today to talk about what is also, a very important topic that's impacting all of our states, was impacting our states before COVID-19 and will continue, and just really have a kind of a conversation today about what Utah can be looking at as marijuana policy changes. And I come from the state of Maine, and so one thing I'll be bringing to this presentation is sort of the experience of what we've seen in terms of the timeline of how policy changes, how the different facets of that impact our work in prevention, and then what our role is in prevention and sort of the public conversation around marijuana policy. So what we'll cover today is first talk a little bit about the stages of state marijuana legalization laws and the multiple layers of marijuana policy. So we'll talk a lot about sort of policy on a state level, but we'll also talk about things we need to look at local level and then organizational levels, because those are also very important layers when it comes to policy. We'll talk about the importance of prevention, really taking a leading role in identifying those public health issues and really making sure that those are on the radar for our leaders and the general public. Because as we'll discuss, as these emerging marijuana commercial markets do come forward, there certainly are public health aspects we need to pay attention to. And then we'll have a kind of discussion of the intersection of policy and prevention, and how do we approach marijuana prevention in an era of commercialized marijuana? Because and this is a theme that we'll touch upon throughout this presentation. This isn't our first commercialized drug. I mean, we have alcohol and tobacco and others. So, what are some of the lessons learned from those that we can start applying to commercial marijuana? So you kind of got my bio already, but just to, I guess, reiterate kind of where I come from on this topic is my education. My master's degree is in public policy, so that's one part of it. And then I've been in the field of prevention for over 15 years, working at a local, state level. At AdCare Educational Institute of Maine, one of our main functions is to provide training and technical assistance to our prevention workforce in the state of Maine, and then with the PTTC, similarly in our New England region. But as a private citizen, I've also been involved in various areas of advocacy related to marijuana policy and science, both in terms of our Maine affiliate for Smart Approaches to Marijuana, but also did have some again, as a private citizen involvement in the campaign that we had here in 2016 around marijuana legalization, chairing the coalition called Mainers Protecting Our Youth in Communities, which was really about raising that voice of protecting our young people in communities while the state was looking at legalizing marijuana. So just a kind of little couple housekeeping things for me. One of them is throughout this presentation, you won't hear me use the term recreational marijuana. You'll hear me use the term adult use marijuana. One of the reasons for that is, I find that that term recreational marijuana it feels like a normalizing term in terms of how we talk about it. So it's just not a term I like to use. So when I talk about what many people refer to as recreational marijuana, I'll use the term adult use marijuana, and then for medical marijuana, I'll use that term. So just so we're kind of on the same page with that. So let's start with our policy discussion and sort of the lay of the land across the country. And this map kind of gives you an idea of where things are across the country. It might need a little bit of updating, but basically the light states, the light green states, are states that have both adult use marijuana and medical marijuana legalized. The darker states have some form of medical marijuana. And actually in the case of DC, Washington, DC, they actually have legalized possession of marijuana, but they don't have commercial sales, which actually is the same case in Vermont as well, where possession is legalized for adult use, but they haven't legalized commercial sales yet. Earlier, I did a very similar training for the broader region for the Mountain Plains, and so we put together this chart just to give you a snapshot of what marijuana policy looks like in your region. So I think Colorado is certainly one of the more well-known states in terms of marijuana legalization, being one of the first states, along with Washington, that legalized adult use marijuana. And then as you can see in the medical marijuana column, there's many states in your region that have some form of medical marijuana legalized, with the exceptions of Wyoming and South Dakota. So I'll kind of give you a lay of the land in your region of the country. So often when we look at sort of how legalization and marijuana policy evolves in states, it generally follows a very similar pattern, really no matter what state you're looking at. The timelines may be a little different. It may take longer or shorter in some states, but generally it kind of follows the same life cycle, if you will. So usually it starts with some form of decriminalization. And for many states that may have happened way back in the 70s. There were several states that decriminalized possession of certain amounts of marijuana back in the 1970s. And my state of Maine was one of those. Then somewhere along the line, you will see the move to legalizing some form of medical marijuana. From there, in some cases almost immediately, maybe after a couple of years, and the conversations around moving to adult use legalization will emerge. But then in between those two phases, you can see some other things that happen. And I don't know if you're seeing this in Utah or not, but in Maine, we saw this where after medical marijuana was legalized back in 2013, the city of Portland had a vote on a local ordinance to quote unquote legalize possession of a certain amount of marijuana. And I put that in quotation marks because the reality is that state law and of course federal law still trumped that local ordinance. So, it probably is more of a symbolic vote than anything else. But the other thing that you can see in between is, and this will be a theme that we'll talk about often, is post-medical marijuana legalization legislation. So almost immediately after these legalization laws pass, whether we're talking about medical or adult use, legislatures will kind of go into action to start proposing some changes to it, especially if it's something that's passed through citizens initiative. And I'm not sure if that's something you have in Utah where it can be passed by citizens, but when they're passed by referendum, often the legislature wants to get in and make some changes for various reasons. And then same with adult use legalization, and we're seeing this in Maine and other states in New England, where almost immediately after adult use passes and is enacted, you see legislation introduced to make some changes, sometimes for the better, sometimes for the opposite. So I'm just going to use Maine as an example to show you kind of what the timeline looked like here, just to give you an idea again of the sort of passage of time. And again, this can vary from state to state, but in our state, we had decriminalization back in the 70s. 1999 is when we saw the first citizens initiative pass to legalize the possession of marijuana for medical purposes. At that point, that's really all it addressed was possession. It wasn't until 2009, 10 years later, a separate citizens initiative launched to legalize basically the commercialization of that. So the dispensaries and the medical marijuana caregivers who were allowed to cultivate and grow a certain amount of marijuana per patient that they served. From there, we went into the adult use legalization phase. So 2013, as I mentioned, is when Portland had the local ordinance that passed. A year later, we saw two other municipalities in Maine, South Portland and the city of Lewiston, that had initiatives. Actually, that was a split decision. So it passed in South Portland, but in Lewiston, it didn't pass. And then in 2016, we had the statewide citizens initiative for adult use marijuana, which did pass. It was a very thin margin, though. It was very close. Statistically, it was 50-50, but there was less than 4,000 votes between yes and no. So that passed in 2016. Actually, just to go back to that, what's interesting in Maine is a lot of it is politics, but we actually still haven't had our first stores open. Our first stores were actually slated to open this spring. They just started issuing licenses, but with COVID-19 and social distancing, we think that's probably going to get delayed even further into the fall. So talk a little bit more broadly about the stages of legalization, and you really can break it down into 3 stages. Now, sometimes these will certainly overlap. They're not always distinct, but there are really 3 phases you kind of want to look at, whether you're talking about an initiative to legalize for medical purposes or adult use. And the first stage really is the campaign stage, and this is really whether or not it's through the legislature or it's through a citizens initiative. There's a lot of campaigning that happens with that, and that can take a lot of different forms. We'll talk more particulars about that in a minute. The second stage is if the initiative does pass, there's the implementation phase, and that's largely involving your legislature, which is going to craft some kind of bill that kind of sets the direction for how medical marijuana or adult use will be regulated. And then after that, sort of the more fine detail rules are created to govern that. And then the third stage is the post-implementation phase, which again, really can almost start immediately and really kind of overlap with stage 2. And honestly, is probably a never-ending stage because there's always going to be changes that are probably going to come before legislatures to change the direction or change regulations, either make things stricter or looser, and whatnot. And as I mentioned, this really does apply to whether you're talking about medical marijuana or adult use, these stages. So let's go into these in a little bit more detail, starting with the campaign stage. So there are a few national groups, and then certainly within states, groups that form really with the sole purpose to promote some kind of legalization initiative, whether it's medical or adult use. On the national level, 2 of the more prominent national groups are the Marijuana Policy Project and the Drug Policy Alliance. So they will often be involved in state level campaigns, whether it's through providing funding or staffing. In the example of Maine, it was really both. They had a staff person that basically was the campaign chair for the legalization initiative in Maine, but then they were also contributing funding to it. While the Drug Policy Alliance was also, they didn't contribute staffing, but they did contribute funding to the legalization initiative. So those are 2 of the more prominent national organizations. The campaign stage, you really see a lot of different things that will come out. Certainly the media is one vehicle that's used for getting messaging out, whether it's through public events, advertising, political ads, those kind of things. Social media is a big one, and increasingly being used by these campaigns to reach voters or lawmakers or different constituencies. Public events, many different types of public events where maybe just a public panel to talk about the initiative, and maybe a debate or informational sessions. A lot of different types of public events that can happen. Op-eds, other types of earned media, and print media and other forms, and then several other methods. And sometimes the campaigns can get very inventive. Here in Maine, we have a prohibition on billboards. Billboards aren't allowed in Maine, but one of the campaigns got really crafty and basically converted a box truck into a roving political sign, and they went to different cities in Maine to do it that way. So they can get really, really creative in that way. And the other point too is, you've probably seen this in Utah, maybe around your medical marijuana legalization, is that these campaigns do tend to get a lot of coverage in the media. I mean, currently that's probably going to be more challenging with COVID-19. So they probably have a more challenging time now than they did before without it. But absent COVID-19 and before that, certainly they do tend to get a lot of coverage, particularly by local media. But also the national media does a lot of coverage of it as well. So we talk about the campaign phase, and especially with the campaigns themselves and the messages that they want to send out. There's really three main ones that I've seen that emerge in pretty much most of the states, and not all the states. A big one certainly is the revenue piece. How much tax revenues will adult use or medical marijuana, more on the adult use side, how much will tax revenues bring in to the state, and then how can it be used to fund different types of projects. The other one is job creation, whether it's staffing dispensaries or cultivation sites or other aspects with the market. So as a job creator, it's another common message that will emerge from the campaigns. And then the third one really is the criminal justice, social justice message. So these are really the three big ones that you'll really see really pushed from the campaigns. And we really have to make the comment that the campaigns do tend to be pretty well disciplined in that way. Like, they do really focus on these 3 points and really don't stray too much into other ones. They really kind of hit these to get them ingrained into the public conversation. Of course, the messages that really have a harder time getting into the public conversation are the ones that we are most concerned about. So the ones around addiction, the impact on health, both individual health and public health, the impact on our communities and our young people, our youth, the social costs. So when the conversations around tax revenues are happening, it's really just one side of the ledger. There's really not a lot of work that's being done to kind of compute what the social costs will be in a state. Certainly issues of impairment. How would legalization have an impact on impaired driving and other impairment on the road, on the job, and other issues. So this is really where we come in the public health and prevention spheres. And I'm not really even talking about lobbying here. I'm really just talking about just the importance of these messages being on the radar, awareness around these issues that can come from legalization, particularly around the commercialization market, pointing to the experiences we've had with the alcohol and tobacco commercial markets. And there really is a lot at stake when we think about what we've learned from those commercial markets already. But there can be some reluctance within our field. And I've seen this, and I've heard this, and maybe you have as well, to engage in this conversation. I think certainly there is one concern around the lobbying piece, and I think that's where you want to make sure you have your ducks in a row organizationally in terms of what's allowed and what's not there. And CADCA has some really great materials around that. That's something that you're looking to get more information on. But I think just even generally engaging on the topic, there can be some reluctance. And one of the reasons I hear sometimes is sort of the controversial nature this topic, and it is a very controversial one. There's definitely some very strong opinions with this, and so that can be, that can create some nervousness to become engaged. Another one is this idea that, if legalization moves forward, it passes, then there's going to be a seat at the table for us to put all the public health things we want into the bills. And, my experience in Maine and the experience of counterparts in other states is that's not necessarily the case. And then the other thing I sometimes hear is that, well, we need to wait to find out what the final laws and rules are going to be before we figure out how to address that. And the reality is, and as we'll talk about when we talk about stage 3, there really is, the dust doesn't really ever completely settle. The changes will be ongoing, and so it's really important to be engaged as early as we can. So and to think about it this way is that, we are the experts in these areas, whether when it comes to the addiction issues and the public health issues and the community health issues. We're the experts that need to put that on the table. And if we don't, the media will find other people who are all too willing to do that. And this is an example of something we saw in Maine. This was the drug duel. So this is the gentleman I referred to earlier, the staff person from the Marijuana Policy Project who headed up the campaign in Maine. So he staged this drug duel event where he challenged the police chief from South Portland to meet him at the public gazebo. He was going to consume marijuana. The police chief would consume alcohol to see who blacks out first. So this was their public education event. So that's just to kind of, it's kind of maybe a little bit of an extreme example, but just to point out that that if we don't get the messages on the table, if we don't do the education, there's others that will, who aren't bound by the same evidence-based ethics and rules and guidelines that we are. So talk about stage 2, implementation. And there really are 2 stages to this stage of implementation. The first one is really the sort of the first piece of legislation that really kind of sets the direction of what regulation, legalization is going to look like. So the guidance or the direction on how licensing will happen, how cultivation will happen, stuff around advertising, marketing, enforcement. But it's really in the rulemaking that where you get sort of into the nitty-gritty details. One way to think of it is the implementation legislation is kind of the outline, whereas the rulemaking is more the more detailed report. So kind of think of it that way. Or maybe another way to think of it is the implementation legislation is like the executive summary. So it's not the nitty-gritty details. That's really where you really see that in the rulemaking process. And one thing, again, in terms of the public conversation to be aware of is that typically with both of these stages, there will be some form of public comment, whether it's a hearing. Now, granted, where we are right now with COVID-19, those probably wouldn't happen. But once we're past this and back into normal operation, normally legislatures will have some kind of method for public comment, whether it is a public hearing or if it's posted and people can provide written responses. So that's just an important thing for us in public health to be aware of and to kind of keep track of. Maybe in our particular role, our official role, maybe there's some parameters around that as private citizens or if other folks that we're engaged with. Certainly it's going to be important to be aware of as an opportunity to weigh in on some of the public health issues. And, again, just pointing to the examples I've seen here in Maine is that we do see where that voice can have an impact. So some examples in Maine, so in our implementation legislation, we saw some major changes that happened to the initial initiative that was passed by the voters because of some of the concerns that were raised from the public health community. So one of those is we had social clubs in our citizens initiative that passed. So these would have been on-premise locations where people would have been able to consume marijuana. But because of the public health concerns around impaired driving, the legislature for the time being decided to remove those from our implementation legislation. We saw a strengthening in some of the regulations for labeling and packaging because of some of the concerns for appeal to youth. And then we also saw some changes to the rules around folks under 21 being able to access the licensed retail marijuana locations. Initially, they were just going to have some restricted access areas, but again, because of the youth access concerns, they basically just did across the board. They can't access any part of any licensed operation. One more point about state legalization laws, and just kind of a pointer or a pro tip, I guess, if you will, is the issue around loopholes. So as with legislation, there's always the possibility of loopholes emerging, and basically where that comes from is there's what's written in the laws as far as what's allowed and what's not allowed, but sometimes there's not specific things that are written as specific allowances or prohibitions that we'll see the industry kind of take advantage of. So some examples that I've seen in some states, one is around marijuana gifting. So most states that have adult use marijuana legalized have a gifting provision where an adult 21 or over can gift marijuana to another adult 21 or over. What we saw in many of the states was this loophole that emerged where the states didn't have specific prohibitions on not charging for other aspects of that gifting transaction. So, for example, here in New England, both in Massachusetts and Maine, we saw these recently businesses pop up where they were holding to the letter of the law, where the marijuana that they were gifting was free, but they were charging for a delivery service or for packaging, or there was some other product that they were gifting along with it, like a t-shirt or some other edible product, non-THC edible product, and they were charging for that, certainly at a very marked up price. So that's an example of a loophole. We had this other loophole in Maine that basically made it not unlawful for youth to possess. And I'm going to show you what that looks like. So this is page 27 of our 35-page Citizens Initiative. And there's this one innocuous looking line of text that basically what it did is it repealed the civil violation for adults to possess up to 2.5 ounces of marijuana. That's essentially how they legalized marijuana possession in Maine. The problem is our juvenile code in Maine points to that adult code. So with that removed, it basically means it was no longer unlawful for young people to possess marijuana. Now, to their credit, the legislature very quickly, when they came back into session, passed. That was actually the first bill they passed in the legislature, was to close this up. But it's just an example of how sometimes these things can basically hide in plain sight, and why it's really important for us to review these and to bring in experts, to bring expertise that we may not have to try to identify some of these potential loopholes. Another thing around the rule-making piece is sometimes the devil can be in the details. And so while it's really important to really kind of take a fine-tooth comb over the implementation legislation, it is also important to do with the rules. And actually I have a little Easter egg on this slide, if you can see an example of this. So in Maine, they put something in the rules which looks really good on paper, which says that all adult use products have to have a health and safety warning on them related to pregnancy and young people. But when you look further in the rules, it says the minimum font is 6 points. So if you look, I don't know if you've caught this already, but if you look behind the underneath the colored bars here, I don't know if you can read that, but that is what 6-point font looks like. So you can see where that little detail could make it so that these health warnings really are probably not even ever seen, because you can hide it under a logo. Because you're gonna imagine that many dispensaries or many manufacturers are gonna go with the minimum font, which is 6 points. So this is just kind of an example of, kind of a visual example of how, the devil really can be in the details with these rules. The third stage is the post-implementation changes. So that's when, the implementation bill is passed, the rules have passed and have been enacted, but the legislature comes out with almost immediately some changes to those. So the rule of thumb here is that legalization is not the end of the story. It's not the end of the story when the initiative or the legislation passed. We need to continue to kind of stay on top of this. And as with other commercial markets and industries, there's lobbying that goes along with that. So there's many lobbyists, both on the national level, and I can guarantee on the state level, the states that even if you just have medical marijuana, you probably have a lot of lobbyists in your state. Their role is the same as lobbyists in any other industry. It's to look out for their industry and how their industry can be more profitable and whatnot. And so, when we're talking about commercial drug industries, it's not hard to imagine that sometimes that agenda runs counter to our agenda in terms of protecting public health. So again, some examples from Maine that we saw after our medical marijuana laws, some changes that were proposed and were passed was one is that we're I think, first and only state that's repealed the list of conditions for medical marijuana. Pretty much every other state, there's a certain list of conditions, and you have to have one of those conditions to qualify for a medical marijuana recommendation. We actually repealed that in Maine, so there's no longer a list. It's just whether or not a physician feels comfortable signing off on a recommendation. We also used to have a cap on how many patients our medical marijuana caregivers could serve, and that was eliminated. We also used to have a statewide cap on how many dispensaries we could have statewide for medical marijuana. That is actually has a sunset clause. So as of 2021, that state cap goes away. Looking at our adult use legalization, which again just passed in 2016, and our rules just got passed just last year. Some changes that are already coming forward. One is to reduce the buffer zone between licensed marijuana operations and schools. So in the initiative that was passed, it was 1,000 feet. So there's already a bill that's been introduced. It's kind of on pause now with the COVID-19 stuff, but to reduce that from 1,000 to 300 feet, which would be consistent with our buffer zones for alcohol. And that's the argument, is to make it consistent with alcohol. Of course, in the public health community, we're making the opposite argument, that let's increase the alcohol buffer to 1,000. I don't know if we'll get any traction with that or not, but we're pushing it. There's a bill in Maine's implementation law. There's a specific prohibition on delivery sales, so that's specifically not allowed in Maine adult use marijuana legalization. But there is a bill to actually, I think a couple bills that have come forward to allow delivery sales. So I think with these examples, just trying to stress the point that, and with this first part, is that marijuana policy literacy is very critical for our field. Just in terms of being aware of what some of the potential public health risks are, some of the prevention issues that we're going to need to look at, how is this going to affect some of the risk factors that we look at when we think of our young people and public health and community health. So it is really critical, and really at all layers. So from when the legalization initiative is issued, to even when it passes, to when the implementation law is proposed, to the rules and regulations, it's just really important for us to stay on top of this. And that's where, when we think of our coalitions and our partnerships, if you don't have partnerships with some legal expertise, that's something you might want to look at. To go back to that loophole that we saw where with a lawful possession of our young people, we didn't catch that. That was caught by our attorney general at the time, who was actually our governor now. She's the one that pointed that out first. So like if she hadn't found that, I'm not sure anybody else would have, until it was too late. And when we're looking at what kind of provisions should we be looking at when we're looking at these, whether it's the implementation legislation or the rules. I mean, these are just some examples, but what are the rules around advertising, labeling, packaging, the buffer zones, possession limits, age limits, plant limits? What are the local control options? What options do the municipalities have at their level? The different license types. So these are just examples. There's a lot more that you could probably pay attention to. But I think at a minimum, these are kind of the ones we want to keep track of. So just look at a couple of examples of sort of the states that kind of gone before us in terms of adult use, and maybe some lessons learned from there in terms of policy. So one we can look at is Oregon. And the example I want to look at with Oregon is right now in Oregon, they have this glut of marijuana production. Basically, last year's harvest, so 2019, there's a pot surplus of more than 1 billion joints. And we look at it per capita in terms of years of THC supply as at January 2019, and you might need to move your I don't know if you have the same box I do with me. I might need to move that out of the way so you can see it. But January 2019, the per capita THC supply was at 6.5 years. So basically, we've had this major overproduction of marijuana for adult use in Oregon. And why is that important? And so we can look at what we've learned from alcohol. But anyways, what we've seen is the huge price drop of marijuana in Oregon. So it's gone from $10 a gram to less than $5 a gram. And when we look to the alcohol research, the reason, of course, and I'm sure most of you are kind of hit upon this before I advance the slide, is that we know the examples from alcohol and from tobacco, the price sensitivity for our young people, and the risk for overconsumption or high risk consumption amongst adults as the price drops. So this is something we would be very concerned about seeing in our states if this were to move forward. So one of the policy areas of policy that can potentially mitigate this or prevent this that we're seeing in some of the states is putting in this provision where most states will have this tiered approach to marijuana cultivation, where each tier is, so when you apply for a license to cultivate marijuana in a state, there's a certain tier you can apply for. So basically, how much are you going to grow in your facility? So there is this provision I've bolded that's come up in a lot of states where before you move from one tier to another, so if you want to move from tier 2 up to tier 3, you first have to demonstrate that you're selling at least 85% of your product. So this is one way states are trying to put into policy a way to kind of put a brake on the production of the cultivation, the harvesting of marijuana, to make sure we try to not get into a place like we are with Oregon, where they have so much harvested, because there's the price drop issue, but there's a lot of other issues that can go along with it too, not the least of which is issues with the black market, where if you have a lot of states surrounding you that maybe haven't legalized, so you can start seeing that flow over state borders. But you can also have issues within state borders too, where it goes into the black market supply. I'm looking at Colorado. One of the issues that they dealt with was the issues with the edibles. In the early phases, a lot of the sort of candy and confectionery edibles were these segmented chocolate bars and similar types of products where each segment was an adult dose of THC, and we saw the issues with overconsumption, along with a delayed effect of edible THC. So we saw this spike in exposures to very young children or to teenagers and adults that are basically consuming too much because it wasn't hitting their system right away. On top of the issue with very young children, where outside of the package, it looks like any other kind of edible product. And so there was the issue of basically poisonings and exposures to young children. So ER admissions and those kind of things. So again, when we look at what's the policy response to this, states trying to get more strict with packaging and labeling requirements. So requiring that individual doses are individually wrapped, that packaging is opaque, child resistant, tamper evident. When it comes to the peel of the products, to limit the shapes they can be in, what can go in the packaging in terms of cartoon characters and those kind of things. So this is another policy response you're seeing in states to try to mitigate and prevent some of these issues. So So we've talked a lot about state policy. You know, on the federal level, not a lot has really changed. I mean, you probably, if you do follow federal policy and news closely, you'll know that there are a lot of bills that can get introduced into Congress. Maybe it's something around banking for dispensaries. There have been bills that have come forward that do look at trying to reschedule marijuana or deschedule marijuana. I mean, so far nothing has really passed from Congress that's made any significant changes on the federal level. So it's mostly, you know, introduction of different types of bills and initiatives. But a couple other layers we do want to think about: the municipal level and organizational level. Let's talk a little bit about municipal policy in terms of adult use and medical marijuana. So if a state does move forward with medical marijuana legalization or adult use legalization, one of the things they have to think about is what are the local control options for municipalities. I mean, I don't know whether your culture is like in Utah in terms of local control. I know in Maine we're a very strong local control state. So one of the things that we saw happen here is that the state basically allowed municipalities to have opt-in control. So what that means is that when adult use legalization was passed and enacted in Maine, basically the municipalities have the option to opt in to whether or not they're going to allow retail sales, cultivation sites, manufacturing, any kind of adult use marijuana operation. So by default, basically all the municipalities in Maine were dry towns for retail sales. Now it doesn't affect possession, it doesn't affect adults being able to grow at home, but it's just really the retail piece of it. Most other states are opt-out states where they have to have some kind of local ordinance to say they're not going to allow retail sales. So that's a big decision that states have to make, whether they're gonna, what kind of local control that municipalities are gonna be able to have. But beyond whether or not the opt-in or opt-out of sales, there's other things that municipalities have to look at, which are things around zoning. Are there any local rules and guidelines they want to enact on top of the state rules and guidelines? What is local enforcement going to look like, both in terms of what are the resources available for local enforcement, but also, or what are the resource needs going to be for local enforcement? Who's going to do it? Is it like code enforcement officers? Is it regular law enforcement? Like, how does that get handled? What are the buffer zones going to look like around schools? So are they going to enact a stricter buffer zone? Are they going to be allowed to enact a stricter buffer zone? There's issue around smell and nuisance. The smell one is a hard one. I'm not sure if any municipalities really landed on a good way to deal with that yet, but certainly it is an issue that does come up. But then there can be other nuisance issues such as traffic to, you know, if it's a retail, whether it's a store or a cultivation site or a manufacturing site, there can be some traffic issues. Parcel limits for home grows. So most states, when they pass adult use marijuana, they'll say that each adult can grow so many plants at their home. So some states or some municipalities will enact a limit on that. So for example, in Massachusetts, it's 6, they can have 6 mature plants per adult. So in theory, if there were 4 adults, they could have 24 plants. So I mean, some municipalities will enact a cap on that and will say, well, even if you have 4 adults, we're going to cap it at 12. And then local licensing fees. And that can tie into some of these, such as the local enforcement. So it'll be really important for a municipality to look at what are their resource needs going to be for local enforcement. And then that can, you know, inform if they're going to enact local licensing fees for dispensaries and cultivation sites. Like, how high should that be so they can use those fees to fund some of those resource needs? The other important layer is organizational policy. And this is where this is a role I think we in prevention can play in terms of just providing some guidance on how to do good work around organizational policy. So when we think about whether it's medical marijuana or adult use marijuana passing, there's a lot of organizations that have a lot to think about in terms of what kind of policies they have around either their client base or their employees, who they serve, who they work with. So that can include housing. So certainly that's going to be landlords thinking about what kind of policies are they going to have for their property, for tenants, for education, both K through 12 and colleges and universities. So for K through 12, I think certainly the policies for young people are going to be pretty easy because most states are going to say it's under 21 is not going to be allowed for possession and all that. But you have events where adults come onto the campus, whether it's sports events or concerts or those kind of things. So you got to think about what are the rules for adults around that for possessing and whatnot. For colleges and universities, certainly, they're going to have a mixed population of under 21 and over 21. So what are the rules going to be for the dormitories? Employers, what are the rules and regulation? What are the policies going to be for employees? Healthcare, transportation, and you could probably think of many others. So I think, for those in prevention, one role we can potentially play is providing some guidance on the importance of, if an organization is going to enact policy, what are some things they need to have in place? So there's going to be a policy change at a university or a policy change at an employer. Some of the important things that they're going to need to do around this is training around the policy change, enacting and communication strategy around the policy change. That's going to be really important at universities. So if a university is going to say, even if you're over 21, you're not going to be able to possess on the dormitories because we're federally funded and all this stuff. We want to make sure that's communicated well, because otherwise there's, they're going to show up with it, and then you get some problems to deal with. Monitoring and evaluating the policy changes. Is a policy change effective? And then, periodic review and revision of policies. So I think this is, again, a role, because it's something we deal with, working with schools on policies around, school policies around substance use and whatnot. So, I think we have some good advice and expertise that we can lend in this area. All right, next I want to go, so we've talked a lot about the stages of policy, towards sort of really the state level in terms of legalization, the different stages of the campaigns and whatnot, the different levels of and layers of policy. So I want to move into really talking about, so now, if we are looking at legalization happening in our state, or if we anticipate it may be coming, what can we start thinking about in terms of, our role in prevention? What do we do? How do we deal with this? And the good news is we do have some tools already in the toolbox that we can use. First of all, certainly is the strategic prevention framework. And so, I think if we are looking at legalization happening, if it's already happened, weaving that into our process. So starting with the assessment process, as we're doing a needs assessment. So if we have seen medical marijuana pass, are we starting to see some changes in our community that we need to, in our data that we need to look at? Whether it's, are young people getting access because more parents have it at home? Looking at, are dispensaries opening? How close are they to the schools? So there's a lot of different data points that we can gather in our community assessment to look at that. And then from there, obviously, it can influence the rest of that process. The other tool we have in the toolbox is the CADCA 7 strategies for community change. So when we do our needs assessment, we identify some of the issues that we're going to need to address. We have the 7 strategies to help us think about what our approach will be. But let's talk a little bit more about when we do sort of the needs assessment part of it, to try to identify what some of the emerging issues will be, or may already materializing around legalization. How do we capture that? And we can really look at the intervening variables as the starting point. And so, of course, we know from our research, our prevention, the way that we do prevention is that there are these different groups of factors that we know from the research that can contribute to substance use. So that's the other good thing, is we already have the research that really categorizes some of the risks that we need to kind of be aware of when we're looking at the policy and we're looking at some of the changes that can flow from the policy changes. So we know that some of these include the low perception of risk and harm. And when we think about, this is where I think the stages of legalization are important, and really that campaign stage, because one thing, we definitely see in Maine, and I don't know if you've seen it in Utah with any campaigning around your medical marijuana changes, is, just again, that messaging that comes out from campaigns, there can be some normalizing aspects of that. One of the messages that we heard often in Maine was that marijuana is safer than alcohol, right? And so, for adults, particularly if we're in the public health sphere, we can nuance that. We can understand what they're trying to say. And I'm not saying we agree with it, but we can understand what they're trying to say with that. For a young person, for our young people, they hear that over and over again. It can be kind of that game of telephone where after a while, they're not hearing marijuana is safer than alcohol, they're hearing marijuana is safe. So that can really flow into this issue around the perception of risk and harm. But frankly, I don't think you probably know this too, I don't think this is just for young people. I think it can be for adults as well. When they're bombarded with these messages over and over again, it really can erode or affect the perceptions of risk and harm amongst young people and adults. Retail access. So again, this is another one when we think about the policy and how policy could affect this. Are there going to be any rules and regulations around density? And that's where local policy is going to be important. Are there going to be any density requirements or restrictions? If a city decides to move forward with legalization, and where they're going to locate dispensaries. Social access, certainly that's a harder one, a more challenging one to do around policy, but definitely our work in prevention, that's one we're going to have to think about. How do we deal with adults, older siblings, older family members, buying products for young people? Because I think we know that will happen as it currently happens with alcohol and tobacco. Pricing and promotion, and we talked about the example from Oregon in terms of the overproduction and the glut that they have there. But as dispensaries open, what kind of pricing and promotion strategies come with those? Is there going to be anything in policy and rules and regulations to restrict what dispensaries can do around pricing and promotion? Sort of like buy one get one free, or show us your ski pass and you get a free joint, those kind of things. Policies and enforcement is going to be, really important as these things roll out, as these state legalization policies roll out. So, there could be really strong policies, but if the enforcement isn't there, as we know from the examples of alcohol and tobacco and pharmaceuticals, that can have an impact on our communities. And then the norms favorable to youth substance use, both on a community level and a family level. So we know from the research, right, that these are important intervening variables that in prevention we need to pay attention to. And so again, this is a structure that we have that we can already use when we start thinking about what is our approach going to be to commercial marijuana. And of course, as we identify our intervening variables, the next step, of course, is going to be to really identify those contributing factors or those local conditions that tell us that these intervening variables are an issue. And that's, of course, part of our needs assessment. So we identify that retail access is an issue because we observe these local conditions or these contributing factors in our communities. And here's just sort of a sketch of what that can look like. But I'm going to walk through a very specific example. But of course, as we know that an important piece of this is going to be gathering the data. So it's not just going to be enough to say, well, retail access is an issue. Well, we know it's an issue because of the outlet density. And we know that's an issue because here's the data that shows the density in our city or in our municipality. So as we identify these contributing factors, it's going to be very important. both in terms of the public messaging around it to demonstrate to the public that it is an issue, but also as we figure out what our approach is going to be, our prevention approach is going to be, it's going to be very important to have that baseline data so we can monitor whatever our strategies are, that whether or not they're being effective. So let's look at a specific example. So let's say, retail access to marijuana in the community is the intervening variable one of the intervening variables we're finding in our needs assessment. So the factors that we may be seeing, the local conditions could be that there's a nearby dispensary close to a school that is not carding their customers consistently. So it may be that a lot of fake IDs are able to get through, or it may be just that they're not checking everyone consistently. Another local condition could be just the location of the dispensary itself. So, it's maybe the state has a 1,000-foot buffer zone, but at the local level, they've decided it could be 500 feet, and this dispensary is at that 500-foot distance. So that could be a contributing factor. And of course, you would have that data with that. Another contributing factor could be adults 21 or over are buying products for minors. So is that that could be a social access issue, but it could also be a retail access issue because of pricing and promotion that's happening at the dispensary. So, so when you think of this specific example, you might think of other local conditions that you've seen that you could imagine that would come from this. So now that we've entered, as we've identified our local conditions, our contributing factors, and then our intervening variables, and as we have our data, now we can continue our strategic prevention framework process to start thinking about, so we can look at our capacity and then start doing that planning to think about, all right, how are we going to address these? And so we do have that other tool already in our toolbox, which is the 7 strategies for community change from CADCA and the research at the University of Kansas that we can use to kind of help frame our thinking and our approach to this. So those 7 strategies are to provide information, to enhance skills, to provide support, reducing access or enhancing barriers, changing consequences either through incentives or disincentives, changing physical design, or modifying or changing policies. And when I was, when I learned about this, actually it was when I did the Coalition Academy with CADCA, the trick I was taught is that you start with the policy that you want to modify or change, and then have your other 6 strategies kind of tie into that. One, it kind of makes a more effective or efficient approach when everything's kind of tied together, but it can also be helpful with resources as well. So again, let's look at an example from our prior example. So let's say the local condition we want to address is that the nearby dispensary is not carding their customers consistently. So we're gonna go to my second slide here and say that the policy that's being put forward to change is at the municipal level, they're gonna require that all dispensary staff are trained in some kind of curriculum on a responsible service that involves consistent ID checking, identifying fake IDs, and those kind of things. I'm not sure if this is actually a curriculum that anyone's actually developed yet, but let's just say for the sake of argument that this is something that exists. So we'll go back to and go through our 7 strategies. So for providing information, one of our strategy there might be to pull together a town hall, or maybe a series of town halls, depending on the size of your municipality, that's gonna do some education on the effects of marijuana on youth, including the importance of preventing retail access. So this is our opportunity to provide what we know around the brain science, the youth development science, and tying it to this retail access issue and why it's going to be important for this policy that we're considering. Looking at enhancing skills, so that will be developing that curriculum, or that training for the dispensaries on again, checking IDs, consistent checks, and other things. Providing support. So maybe, a municipality wants to offer a tip line. So there's a way to anonymously report underage sales that are happening in a particular dispensary. Looking at enhancing access and reducing barriers. So that might be looking at facilitating access to technology for the dispensaries to be able to better detect fake IDs. I know that's actually an initiative we've been looking at in Maine around our alcohol outlets, where there's this new technology that's emerged. I think it's an app that can be downloaded for checking IDs. And so we're trying to work with, the licensed alcohol outlets to adopt or to invest in that technology. So so maybe there's a equivalent of that could be used for marijuana dispensaries. When we look at consequences, so you can look at both incentives and disincentives. So certainly a disincentive will be, regulatory actions against dispensaries that are found to be selling to minors or not carding properly. So, fines or whatnot. But incentives could be, if you're doing some kind of compliance checks around this, maybe there's some kind of recognition for the dispensaries that are, that have 100% compliance. And then maybe, the clerks or maybe the owners of those dispensaries have some kind of incentives for their staff. And thinking about physical design, maybe there's something about the design of the store itself that could be changed that makes it easier to check IDs, or makes it easier for more consistent checking of IDs. So there could be some physical design things there. So again, just an example with one specific example of retail access and not carding consistently, of how we could potentially approach that with some strategies. Certainly, you're going to want to make sure this is all based on data and the actual condition that you're observing in your area. But again, just an idea of what that could look like. So that's again, thinking about how to start thinking about how to deal with prevention in commercialized marijuana. But I think, the next step is, or another angle with this is the policy solutions, which I think is important to discuss. And we've talked about a couple of these already, but as we do see the public health issues emerge from legalization, or we identify issues in implementation legislation or rules, we can start thinking, well, what are the policy fixes for those? So on the state level, I think there's a lot of things states can be looking at that can help on the public health front. I mean, one of them is, all states are really keyed into tracking the revenue data and, the jobs and those kind of things. But I think if states could require that they're also going to collect, monitor, and report on the public health data, that's going to be an important piece. And that's something we really push for in Maine, is to get that requirement in the legislation. The good news is we did get it in the implementation legislation. The bad news is they haven't done the rulemaking for that yet. Requiring strict standards and regulations for packaging, labeling, and advertising. Requiring training for dispensaries. Again, I'm not sure if that's a training that's actually been created yet, but hopefully that's something that does get created for the states that do move forward with commercialization, because I think it is going to be important for to make sure we're addressing those retail access issues. Excuse me. Revenues for funding prevention education. Some states do that. Some states you do see a little bit of money that's either through legislation or the initiative that they do earmark for prevention education. Other states really haven't done so well with that. So again, just a thing to have on the radar, because certainly it is going to be more work for our field to do on top of all the other work that we're doing. So I think, having adequate resources is going to be very, very important. And I think I know I'm preaching to the choir on that one. The buffer zones, and I think encouraging a broader look at the buffer zones. So yes, schools are very important, but it needs to be public and private schools, but also other schools, like maybe martial arts schools, dance schools, like any kind of a school like that where you got young people, that you're serving, thinking about including those in buffer zones, and of course, daycares and other youth serving organizations and institutions. Municipal level, the municipalities have a lot to think about. First of all, if the state does decide to allow an opt-out or an opt-in, that's really the first decision they have to make, which one if they're going to do that. But then if they do decide to opt in or not opt out of sales, a lot of things they have to look at are, again, are they going to require some kind of mandatory training for dispensary staff to mitigate and prevent youth access? Thoughtful zoning to prevent the density issue, but also to look at, are they going to be near other family-friendly things like, ice cream stores and those kind of things? Are there going to be local restrictions on advertising and promotion, like local restriction on what can go on the literal storefronts of the dispensaries? Some strong policies for those public spaces. I think it's going to be one thing for the state to say, public consumption is not going to be allowed, but I think the local level still needs to do some work on, how is that going to be enforced? Like, what does that look like in recreational areas? How does that apply to possession in public spaces? So there's a lot to look at there. The home grows, I think municipalities have a lot to think about there as well, because the home grows can be a potential public safety issue. If you have someone in a residential zone or a combined use zone that has a home grow, and they have 2 or 3 adults, so that means they might have a lot of plants that they're growing. Looking at are the requirements for obscuring those, so fencing and home security systems to kind of prevent that from being a target. Really, is sort of the public safety concern there, because we do see in a lot of states, we've seen it in Maine, you do have some they can be targeted for robberies and thefts. So I think we're going to move next into time for some questions, but just do first, before we go to that, share some resources that are out there for marijuana prevention. First, got to plug what the work of the PTTC network is doing, the Prevention Technology Transfer Center Network. So both, the individual centers are all, of course, doing work on this, responding to technical assistance needs and training needs that our different regions have. We do also have a network-wide marijuana work group, so that has multiple centers from the network meeting. Actually, we meet twice a week. I'm actually the chair of that work group to develop some tools that can be deployed across the country. So you may have seen our marijuana education toolkit, which includes a couple of slide banks to use. There's a fact and myth sheet, and then there's a cannabis glossary. So you've used that. That was actually a product of our work group, and we're hard at work at some more trainings and products. So stay tuned for those. SAMHSA does did very recently come out with an evidence-based resource guide for marijuana use in pregnancy. So if you haven't seen that yet, definitely encourage you to check that out. All these links are live, so when you get the presentation, you'll be able to click on these links and to go to these. There are a couple of resources that have been developed that pull together some evidence-based strategies for marijuana prevention, maybe not specifically to commercialization yet, but in general for youth and young adults and other populations. So the updated inventory of programs developed by Washington State Institute for Public Policy, that's a really great resource. And then preventing youth marijuana use programs and strategies, which was pulled together by the CAPT and was most recently updated in 2017. So those are 2 pretty good resources that I would highlight as well. So I'm going to leave this up here for now while we go into questions. So if you have questions after this, take note of my email address so you can send me questions later if you think of them later. If you're active on Twitter, you can follow me on Twitter, also our New England PTTC as well. We do, since marijuana training and technical assistance is our specialty area for our New England PTTC. We do a lot around that, so definitely follow us there. But with that, I will pause for any questions that there may be.